Now we can transition from enzyme kinetics into the high-yield concepts of pharmacokinetics and pharmacodynamics. Now, what's the difference between these two? Pharmacokinetics can be simplified to how the body affects the drug. The body can affect a drug in four major ways: the absorption, the distribution, the metabolism, and the excretion of the drug. Now, pharmacodynamics, on the other hand, is how the drug is going to affect the body. So one way to remember this is drug and dynamics both start with D. So pharmacodynamics is how the drug is going to affect the body. Again, we've got four kind of major topics that we need to talk about. We need to talk about receptor binding, drug efficacy, drug potency, and toxicity. So we have a lot to talk about. Okay, we'll first focus on pharmacokinetics, or how the body is going to affect a drug. Now, it's important to define some concepts within pharmacokinetics. Bioavailability is going to be designated by a capital F here, and it's going to represent a fraction of an administered drug that's going to reach the circulation. So let's say a bioavailability of 100% is just going to be a 1, and a bioavailability of 50% is going to be 0.5, for example. Now, how is it going to be tested on boards? On the USMLE, make sure you factor in the bioavailability of a drug. Many equations utilize bioavailability, and therefore it's going to be an easy way to miss a point on test day. So let's take a look at how we may see it. If they say a drug is going to be given via IV, you're going to need to know that the bioavailability of that drug is going to be equal to 1, or 100%, so we don't have to really factor it into the equation. So let's demonstrate why this is true. Now, as a drug is going to be given in a vein, which is going to drain into the heart, and then it's going to be pumped to the rest of the body. Nice and simple. From here, the drug is going to be broken down, possibly by the liver, but initially it has a 100% bioavailability. It's going to go straight from the vein to the heart, and then into the body. For oral administration of a drug, the bioavailability is going to equal the fraction of a drug that is absorbed and survives the first pass effect through the liver. Now, the bioavailability for most oral medication is going to be less than 100%. So do you have an idea of why it would be less than 100%? Now, if a drug is going to be given PO, so by mouth, it must go through the gut or the intestines where it gets absorbed. The drug is going to go through the portal vein, which will drain to the liver, and then here in the liver the drug is going to be altered, metabolized through the first pass effect. The drug then goes to the hepatic vein, which will drain into the inferior vena cava, goes to the heart, and then eventually gets pumped to the body. Now notice how if we give a drug orally, the route that we have to take has to pay the toll at the liver. So our availability is going to be less than 100%. So we're going to have a fraction. The bioavailability will represent a fraction. While if we give a drug via IV, it's too simple. So this is known as the first pass effect down here. So now let's talk about another component of pharmacokinetics, and that's going to be the volume of distribution. The volume of distribution, also expressed as V sub D, is going to relate the amount of drug in the body to the plasma concentration of that drug. So, amount of drug in body divided by plasma drug concentration. Alright, so the units for volume of distribution are usually expressed in liters. Now, drugs that distribute into larger spaces have a higher volume of distribution and vice versa. So drugs that distribute into smaller spaces have a lower volume of distribution. Now, what are some properties of drugs that would prevent them from distributing within the body? Let's first take a look at size. A large drug is less likely to cross the cell membrane, So it will essentially be trapped in the component it was originally in. So here we have a phospholipid bilayer, and we have a large drug here, drug X. Since it's so large, its size is going to prevent it from crossing the phospholipid bilayer, so it's going to be trapped. On the other hand, we're going to have a smaller drug Y here, and since it's smaller, it can cross the phospholipid bilayer more readily, so it can distribute to larger spaces within the body. Now, what effect do you think charge has on distribution? If a drug is neutral or uncharged, it can readily cross a phospholipid membrane. Now, so let's draw a UC for uncharged particle here. Drugs with these properties tend to be lipophilic, and then they can distribute to larger spaces within the body. Now, drugs that are going to be carrying a large charge, so a very strongly positive drug, for example, cannot cross membranes as easily, and therefore they're going to be trapped within the water components of the body. Now, another way to think of this is drugs that are hydrophilic, love water, and they're not going to be able to cross the phospholipid bilayer as easily, so they must stay within the body's water components. Alright, so now let's take a look at another influence on the volume of distribution, and that's going to be protein binding. So what influence does protein binding have on the VD? Now, the volume of distribution of plasma protein-bound drugs increases in liver and kidney disease because of the decreased protein binding. Now, in liver and kidney disease, patients do not create proteins as effectively. So here we have an example. Drugs that bind to proteins in circulation, they aren't active. So when a drug representing that red triangle binds to a protein, which kind of represents this gray blob, when they bind, that drug is not going to be active. So if all of a sudden the body doesn't create proteins as well, then less drugs will be bound, meaning they are free to leak out of the compartment and has a larger volume of distribution. It's like saying if all of the metal bars are taken away from a prison, prisoners won't be confined to their cell compartments, and they'd be free to wander about the prison, distributing themselves to larger areas. Same concept here, when proteins act as a jail to the drug, and they keep that drug in a particular compartment of the body. So now that we covered some characteristics that affect the volume of distribution within the body, I'm going to present the same concepts in a different way. Now, do you remember what properties a drug would have if it had a small volume of distribution? A small volume of distribution is associated with drugs that are confined to the blood compartment, such as large hydrophilic molecules. For example, if a drug is limited to the blood compartment of the body, it's going to have the same volume of distribution as the blood volume, since the volume in which it is distributed is the blood. Now, a medium volume of distribution is associated with drugs that distribute in extracellular spaces or body water, such as small hydrophilic molecules, because they can get out of the bloodstream, but not into the cells themselves. And then lastly, a large volume of distribution is going to be associated with drugs that distribute through all tissues, including fat, so small lipophilic molecules. For example, now if a drug has a volume of distribution greater than the blood volume, that means the drug has characteristics that allow it to diffuse out of the blood vessel and into other components of the body. However, if a drug has a volume of distribution equal to the blood volume, that means it's going to be trapped and confined into the plasma. Do you remember what the 4 core principles of pharmacokinetics were? It includes absorption, distribution, metabolism, and excretion. We've already covered 2 of those concepts, both absorption and distribution, over our discussions of bioavailability and volume of distribution. Now we should turn our attention to the concept of drug excretion. The half-life is the time required to change the amount of drug in the body by half during elimination or constant infusion. We can typically write half-life as an equation. Under conditions of first-order elimination, the half-life is equal to 0.7 times the volume of distribution divided by the clearance. So we'll talk about what first order elimination means in a few minutes, but I want you to be comfortable with this equation because you may need to calculate the half-life of a drug on test day. Another important concept to understand is a drug given at a constant rate usually takes 4 to 5 half-lives of that drug for it to be eliminated from the body. Likewise, it takes approximately 4 to 5 half-lives to reach a steady state. Now, I think it'll be important to use a practice question to clarify this concept here. So if you hypothetically started with 100 milligrams of drug A, how much of drug A is remaining after 3 half-lives? Well, let's map this out. Let's start with 100 milligrams of drug A. By definition, after 1 half-life, there should only be half of that initial dose left. So after 1 half-life here, there should be 50 milligrams of drug A left. If you go through another half-life, you're going to get 25. So this is 1 half-life. This is another half-life. You're going to get 25 milligrams of drug A. And then you can keep going on and on. So finally, after 3 half-lives, there should be 12.5 milligrams remaining. If you continued this out to 4 and 5 half-lives, there would be 6.25 and 3.125 milligrams remaining, respectively. So essentially, after 4 to 5 half-lives here, there would be such a small amount of that initial drug that we can just say that the drug is effectively eliminated from the body. This drives home the fact that it takes typically 4 to 5 half-lives of a drug to be eliminated from the body or to reach steady state. We can do another quick example to demonstrate this concept. The half-life for drug X is going to be 1 hour. A patient is given a constant dose of drug X every hour, starting at time 0. After 3 hours, before a 4th dose is given, how close to steady state is the concentration of the drug within the body? Now, this is going to be an important question. Half-life is going to be 1 hour. Patient's given a constant dose of the drug every hour, starting at time 0. After 3 hours, how close to steady state is the concentration of the drug within the body? The answer is 87.5% of steady state. Now let's discuss how we got this. We need to incorporate the concept of half-life to figure this out. Now the steady state means the drug is going to be saturated in the body and is not going to accumulate a given dose because elimination and accumulation are balanced. It's sort of a dynamic equilibrium. Now I like to think of this in teeter-totter terms. Initially, early on, when we first give the drug, the accumulation side is going to outweigh the elimination side. And this is because we don't have very much drug in the body initially, so we're not going to eliminate much of that drug. Now, after multiple half-lives, our equilibrium is going to balance out, where our accumulation and elimination will eventually equal each other. And this is because as more drug accumulates in the body, we're able to get rid of it at a faster rate. So we're still giving a given dose of drug at a constant interval. However, now that drug's built up in the body, we can eventually eliminate it, and then after time, in our steady state, we'll reach equilibrium here. So in the example question, we hypothetically give a drug every hour. Now this conveniently happens to be the half-life as well. The half-life of this drug is going to be an hour, and we're going to give this drug once every hour. Now, notice how we don't have the dose of a drug. It's not important for this question. You don't need to know the dose of a drug to figure out how close to steady state it is. So let's map out. At time 0, we're going to need to give a dose. Now, since there's no drug in the body at time 0, we're going to have 0 elimination. However, after 1 hour time, we'll have that drug that's in the body be eliminated in half. Now, the half-life is the time it takes to get rid of half of that drug in the body. Our half-life is 1, so after 1 hour, half of this initial dose will be gone. I'm going to shade in the portion of the drug that's remaining. So after 1 hour, we have half of that initial dose. Now, we're going to give another dose. Remember, we're giving a dose of that drug every hour. So after 1 half-life, we have 50% remaining. Now we're also going to give another dose of that drug. Okay, so after 2 hours, how much of the drug do we have remaining? How close to steady state are we after 2 hours? Now to answer this, we just need to take a half-life one step further. So our half-life is still 1 hour. So after 1 more hour, we're going to take a look at this dose. This second dose that we gave will be halved. Our initial dose is going to be further halved. Since we only had 50% of that original dose remaining after 1 hour, after 2 hours, we'll only have a quarter of the original dose. So we'll only have 25% of that drug remaining. So after 2 half-lives, before that third dose is given, we will have 50% plus 25%, so we'll have 75% of the drug close to steady state. We'll be 75% of the way there to steady state. Now, after 3 half-lives, we're going to need to give another dose here. So we give that third dose, because remember we're giving a dose every hour. Now, the question said, after 3 hours, before a fourth dose is given, so we're not going to give another one of these full doses. Before a fourth dose is given, how close to steady state is the concentration of the drug within the body? Now, to figure that out, we need to just take this half-life concept one step further. So again, we have 50% of the dose that we just gave. This dose that we gave at the 1 hour mark will be a quarter remaining, because we just have 50%. Remember, everything halves after 1 hour, because that's the concept of half-life. And then our original dose that we gave very early on will be halved again. So, doing some math, this is 50%, this is 25%, and this is 12.5%. Now, I hate math, however, I can do this in my head. That would be a grand total of 87.5%. Voila! There is our answer. Great, so we are at 87.5% of half-life. Now remember from the previous slide, I said that it usually takes 4 to 5 half-lives to reach steady state. So we're almost there, we're almost at steady state. So we'll need to give another dose here. Check that out. Usually after 4 to 5 half-lives is considered steady state. Our teeter-totter is still a little crooked, but for the most part, our body has reached a steady state. Alright. Now we will continue with our discussion on pharmacokinetics and elimination. Clearance is the amount of plasma cleared of a drug over time by the heart, liver, and kidneys. Now it's important to remember the following equation because USMLE may require you to calculate the clearance of a drug given hypothetical values. Now, the clearance is going to be equal to the rate of elimination divided by the plasma concentration. Now, this is also equivalent to the volume of distribution times the KE. And the KE is going to be a rate constant of elimination, which is equal to the natural log of 2 divided by the half-life. Alright, so it's important to note that clearance does not refer to how much of a drug is cleared, but to the volume of plasma that the drug is completely removed from per unit of time. Therefore, it's going to be measured in units of volume per time, such as milliliters per minute or liters per hour, for example. So let's do a quick example to discuss clearance. Now, you have 5 liters of plasma, and let's say that 1/5 of the drug is removed per hour. So 1/5 of the drug is removed per hour. Alright, so if a person has 5 liters of plasma and 1/5 of the drug is removed from the plasma in an hour, what is going to be the clearance of this drug? Now this is nice simple math. The clearance of this drug would be 1 liter per hour. The drug is spread out over 5 liters, and if 1/5 of the drug is removed per hour, then that means that 1 liter worth of plasma has been cleared of the drug. So our answer would be 1 liter. So that would be the clearance. Alright, so there is also a related formula that I do want to introduce really quick. You'll see it in the renal section. It includes renal clearance. Now notice how the pharmacokinetic clearance that we just discussed is a little different than the renal clearance, so be careful on test day. Make sure you're looking to see what the question is asking.